Hello, everybody. Sandra Ford with Trusted Senior Specialist, and we're coming live today. And happy St. Patrick's Day. Yes, I am not Irish. I grew up thinking I was Irish, but I later found out through my aunt, who did a lot of genealogy, that we were actually Scottish and we were exiled into Ireland. And then from there, we moved into Ellis Island and down to Texas. And in fact, we even had a couple of family members move into Galveston, which is our coastline here in Texas, and became priests of Catholic churches in San Antonio, became big officers and sheriffs, I guess, of those times, about the 1800s, and also another priest. So all these years, I thought I was Irish and found out that I was actually Scottish, but I don't care. I like the color green. And yes, I do celebrate this day because I love to pinch people. So, but I work from home, so my dogs are getting it today, but I'm kidding. Anyhow, so my name is Sandra Ford, and I'm the Senior Compliance Officer with Trusted Senior Specialist. And I'm talking about the changes to Medicare. And one of the things that, I kept talking about over the last couple of mentions of how less the Part B premium went up from 2020 to 2021. It was only $3.90. And I kept saying how this is due to savings and fraud, waste, and abuse. Was really approached and combated over the last few years. And that's why we didn't see that great increase between the 2020 and the 2021 Part B premium, as well as the deductible. Well, I found the number. I was kind of fishing around on the CMS.gov website, and I'm in there, not .com, .gov, and I was in the newsroom and I was kind of fishing around, and I found the number. Over the last since 2016, do you know how much money Medicare was able to save by correcting improper payments? Just guess. The number does not end in a T. The number doesn't even end in an M. Yeah, a B. Over $15 billion has been saved by correcting improper payments from billers to Medicare. And how does that affect you? We saw it kept the premium down. It didn't go any lower. It went up $3.90 from last year, and we'll talk about that in a second. But I'm just saying, wow, they combated the fraud, waste, and abuse. Abuse and waste is a huge thing when it comes to medical expenses. Like when I go into a doctor's office, or if you ever watch someone come out of a surgical procedure in the hospital and they start pulling all the leads off and throwing them away and all the wires and they throw them away, the tubes, they throw them away. I know that is medical equipment and they can't reuse it, but they don't recycle it. And I just look at all this waste and I'm like, oh wow, can't they like recycle any of this and make more? I don't know. Maybe not use it on another person, but recycle it like they do regular plastic, but it all goes in the trash. So that's not necessarily waste, but waste is when things are prescribed and billed to Medicare that's not ever going to be of use. Sometimes the doctor will say, yeah, I can get you one of those. Let me get you that. Let me write you a prescription. And you're like, no, it's okay. They're like, no, it's fine. It's fine. No. And they write you a prescription. That would be waste. And so by them reducing $15 billion, $15 billion in over expenditures and improper payments just in 4 years. $15 billion, man. What did that do for you? As a Medicare beneficiary, it kept that premium from jumping, it kept that Part B deductible from jumping, and it's giving more benefits. I mean, come on. Now, the 15 billion that they saved is probably going to be used for paying for these COVID vaccines because there's no fee to you to receive that if you receive Medicare, and that's okay, right? Not a bad reason to take the money that we saved over here and distribute it over here. But just imagine had they not saved that. So what's my point in talking about how much Medicare saved over the last 4 years? 15 billion in improper payments was recouped. My point is that you should always have your eye on your medical bill. Whenever, and I'll get into this later, not on this segment, but in one of my other segments when we were talking about the T65s and the paperwork you'll be getting when you go to see the doctor with Medicare. And you should be getting this with your regular insurance if you have group coverage. But when you go to the doctor and you have a procedure, they'll send you what's called an evidence of benefits. And evidence of benefits is like a statement and says, this is what the doctor did, doctor did, this is what was billed to your insurance. And if you see something that they may not have done, or you see a procedure that was didn't make sense, you need to ask questions about that. Because, for example, I had a family member in the hospital, and they had her in a knee surgery, and when they came out, she was in a sedated coma for recovery. She was older, and but she's okay. But while she was in that sedated coma, I was looking over her chart because they leave it in the room, and I'm going to look, and because I'm got my eye, I poked myself in the eye. I got my eye out there, and I noticed that they were giving her Benadryl, and I questioned it. Why is she getting Benadryl? I mean, the most she takes is an aspirin a day. That's it. She takes an aspirin a day. Of course, at that time she was 89, and I'm like, why is she taking Benadryl? And they said that because one of the medications that's helping her stay in the sedated coma can usually cause the liver to secrete one of its enzymes, and that causes itching and discomfort. So the Benadryl was just there to give ease in case she was itching, but can't itch because she's in a sedated coma. So to bring comfort. Okay, I got my answer, but I was inquisitive. And so that's what I mean by waste. You should really watch out for is dentist. You ever go to the dentist and then you see all the stuff they start adding up? Okay. So keep this spending down. I was looking on I'm sorry, on CMS.gov in the newsroom just to see if there's anything new that has been released in the last couple of weeks since I've started this series. And other than the COVID vaccine, information, I don't see anything new, so I'm gonna go over, the things that I have been going over, and I'm just gonna make one more check, because I always tell you guys where I get my information. The difference between me finding it and you finding it is I know how to get there fast, and I look for what's gonna be important to you because there's a lot of information in there, but things that may not necessarily be of importance or necessary for Medicare beneficiary because it talks about payments from doctor to Medicare or MIPS and just stuff that doesn't seem to make sense to someone who's not involved with the billing. And so I just one more time, I'm just going to see if there's anything else that I'm going to add to what we're already talking about. Yeah, no, no, I just got hung up on that $15 billion in savings. Wow, from just improper billing. Can you imagine? Can you imagine if you were being improperly billed, and if you were running a business? You got to think about it. CMS is our business, right? Our taxes help fund us, right? And then doctors and hospitals have been improperly billing Medicare, and they went back and did an audit, and they found 15 billion in savings. Yeah, we should be very excited about it. But at the same time, we should be really angry about it too, because what about the other 10 years before that? You know, how much is in misappropriate billing? Okay, I'm going to get off that. Let's talk about changes with Medicare. Um, there's a lot of great things that have happened with Medicare. So, since I was talking about premium and savings, let's talk about that real quick. The Part B premium. The Part B premium, what is that? The Part B premium pays for your coverage because you have Part A, Part B, then you have Part D, Part C, but you don't get D and C on your Medicare card. Okay. And that's why, if you're turning 65 or you're new to Medicare, that's why you're going to tune in for the next quarter because we're going to be talking about what all those different parts are, how they come into play, what do they do for you? Do you have to have them? When do you have to have them? And how do you get them? But there's a lot of parts to Medicare. There's a lot of plans when it comes to Medicare. You have your Medicare Advantage plans, and then under that umbrella, you have how many carriers. Then you have Medicare supplements that helps support Medicare costs. How many carriers do you have with that? How many plans do you have to choose from? How do they operate? How different are they when it comes to help paying for your coverage? Because remember, everything begins with Medicare Part A and Medicare Part B. That is original Medicare. When you get your red, white, and blue card, your Medicare card, if you haven't gotten it, call the office. Call us. Let me give you the number: 1-888-689-9701. Why call us? Because we will help you learn how to not learn. We will help you apply for that card. We'll help you get that information into Medicare so then you get it right the first time. If you only want Part A and not B right now, we'll go over why you should and why you shouldn't because it depends on your situation. But getting the paperwork in right the first time is key. For one, it prevents penalties. For two, it prevents headache. Three, it prevents gap in coverage. big time. And if you're transitioning from group insurance to Medicare, you got to be on time with your business because if you're not, you will have a gap in coverage. And anything can happen to anybody at any second. You can end up in a bad situation and you can end up with a horrible bill. And if you don't have coverage because you're in the transition of going from group to health or marketplace, I mean, to Medicare or marketplace to Medicare, you're going to put yourself up against a wall. So let me give you that number again 1-888-689-9701. That's the Sandra hotline. You call a Medicare expert. We will help you do that application for what's called Original Medicare. So original Medicare, when you get that red, white, and blue card, and if you already have it, it has a Medicare A and Medicare B, but you don't have D on there. That's prescription drugs. That's separate. You have to purchase that separately, or you have to get a Medicare Advantage plan. Those typically carry that drug coverage. It kind of creates it like a bundle, but that will be on next quarter. But I'm just trying to give you an idea of what original Medicare is. A covers your hospitalization. A covers your skilled nursing. A covers home health. A covers hospice. B covers services. So anytime you go see your primary care doctor, your specialist, you have to get equipment, you need an infusion, you need a vaccine, COVID. If you're going to some home health there too, any procedure, outpatient, lab work, blood work, IV bags, all of that follows and falls under B. So you don't want to go around with one and not the other. Now, Part A, we know typically doesn't have a premium if you worked what we call 40 quarters, which breaks down to 10 years, taxable. So if you're an independent worker and you haven't paid into Medicare, you need to get that taken care of, right? We're in the season right now. If you are an independent worker, a 1099 person, you paid your taxes, but you didn't pay into Medicare, you didn't pay in, you really need to talk about your quarters with somebody. Okay. If you're not married to someone else who will qualify for Medicare based on their work. So that's a question. And we don't really talk about that, but that's something we should start having a conversation about. Okay. Now, Part A typically has no premium, but it does have a deductible. The deductible gets you in the hospital or gets you hospice or skilled nursing. And that premium, that deductible, let me say that deductible is $1,484. That covers your first 60 days in the hospital. What happens if you're in there for day 61 or more? Well, day 61 to day 90, you have a daily copay. So you've already paid that 1484, $1,484, and you're in there for 61 days. Now you have a copay. And you're going to have a copay, a daily copay. That means you're going to have a copay for each day that you're still in the hospital. If you're in the hospital up to 90 days, on day 91, guess what happens? They slap on a little bit more money. Not for you to pay. So now you have a daily copay that starts to it's like a stair. It's gone up, and you're going to level at that daily copay for pay daily copay for every day that you're there until day 149. And at day 150, if you're in original Medicare, you're in trouble. And that's why we always tell you, don't go and get just original Medicare and stay there. You know, there's a lot of times that we're talking to folks who have opted in. They want their new to Medicare guide. We want you to have the new to Medicare guide. And then we check back with them. And they're like, oh, yeah, I'm good. I've already got everything taken care of. What did you take care of? Did you just apply for Medicare? Did you get a plan that helps pay for the 20%? Did you get a plan that will cover all of your Medicare costs and then add additional benefits? Did you do that or did you stop? Because if you stop, see, we meet with a lot of people who get original Medicare and they may call and say, you know, I'm kind of familiar with this XYZ company, and they call and get a supplement. And guess what they forgot to do? They didn't get that Part D. And you know what happens? They get a late enrollment penalty. And that penalty lasts them for the entire time that they have their Medicare prescription drug plan. The penalty never goes away. And they're like, well, no one told me. No, we called. We said, we want to make sure you got everything taken care of. We want to ask you a few questions. No, I'm good. I got it all taken care of. But you didn't. So that's the difference of doing Medicare on your own. We always encourage you to do Medicare with us. Why? Because we understand Medicare and we'll never claim to know everything. Heck no. But one thing we know Medicare. And through helping people since 2006, we have seen and saw so many different situations, so many situations, so many different scenarios that we have come up with a great series of questions to ask you because we don't want to leave any stones unturned. I'm going to give you that number one more time. Maybe I'll type it in here. Don't look at me. I'm going to look down. 1-888-689-9701. That is the hotline number. You call and you speak with a specialist, you speak with an expert who's going to help you understand what you need to know and what you should be asking. Because one of my favorite things that people go into a seminar or a learning center or whatever situation or in a learning environment, and they say, don't be afraid to ask any questions. There's no such thing as a dumb question. It's dumb when you don't know what questions to ask and they're not giving you enough information to give you the right info for you to develop a question. That's what I mean. So let me say that again. We're going to ask you questions you didn't know you needed to ask. Okay. Now, let's talk about the part B premium. It did go up. It went up $3.90. And like I said before, that's really such a very low jump from what we've seen before. We've seen it go up, 10%, 15%. We saw it go from 121 to 140 one year to the next. And, that hurts. That hurt a lot of people. That really hurt a lot of people. And so there are programs that do help pay for that Part B premium and medical expenses. And that's another thing that I'm going to toot my horn on that. Our customer service department is excellent, exceptional. We're going to make sure that if you qualify or you, based on the screening of that state and federal program, if it looks like you're going to be able to get that help, our customer service department at no charge, no obligation, they will submit that application with you on the phone or through that government portal, and they're going to get that information in proper the first time, and you're going to get a letter in the mail and says, hey, guess what? You don't have to pay the Part B premium. It's covered. Or they're going to say, hey, guess what? Your prescriptions are going to be at a low cost. This is what they look like now. Yeah. You know how good that feels? I mean, when I got my auto insurance, even though I had a fender bender, my first, of course, in 2020, right? What else can go in 2020? I couldn't believe it. And it was not because I didn't stop at the red light. It was because the light turned green and the lady in front of me slammed on the brakes at a green light and I hit her in 2020, my first accident, my entire driving life. I have an accident. And so whenever I saw my renewal come in, I was so afraid to open my renewal for my auto insurance, and it decreased. I don't know why it decreased, but it decreased. You know how good that felt? Can you imagine how good it'd feel to get that letter in the mail to say, hey, you qualified for this based on your income and your medications? This is going to be the cost of your medication. Or because you qualify for this, you don't have to pay that $203 for your Part B premium. And we can help you bring that comfort. Now, I will say this. You can't do that if you don't have the right information and you're not getting the right, if you're trying, you can do it if you're doing the research on your own, but it's harder to do. So that's why we want to do it with you. And because I brought up medications, that brings me to another change with Medicare. On January 1st, 2021, again, happy St. Patty's Day, everybody. You like the green? I don't usually wear ties, but it's all I could find. Left over someone took my scarf. I had a scarf with shamrocks on it, but one of my kids took it. I guess they needed it for work. They don't want to get pinched. They still work out of the home, but anyway, I like my tie. It's kind of cute. All right, now let's talk about insulin. Insulin is $35 copay for Medicare beneficiaries. There's a lot of confusion out there over this. I want you to understand this. For 2021, the copay benefit for insulin is $35. If you're paying more than that, please call and talk with us. We need to make sure that there's something erroneous doesn't happen in your plan, that you're in the right plan, you've been given the right information. For Medicare beneficiaries, you have been locked in to get that benefit for 2021. We know for certain it's been locked in the $35 copay. For the rest of the market, for those under 65, it's still under review. As we know, with the change in administrations, there's what we call a 90-day moratorium, and that's where all bills that have been signed or soon to be signed, they're going to be on hold and reviewed for those 90 days. And that's only fair because, you don't want to walk in and just say, okay, yeah, let's do this. We got to review this. So that's why everybody else is on hold. But for Medicare beneficiaries, that insulin is going to be the $35 copay. Okay. Now, if you are helping take care of a parent and they're paying more than that, then we need to talk. Did I talk about our website? I don't think so. I want you to look at our website and you can see, here you go. Okay, so trustedseniorspecialists.com, or to make it easier, TSS, like Trusted Senior Specialist, TSS loves plural, lovesyou.com. I want you to go on the website. Why? Well, you can call in the hotline anytime you want, talk to somebody. But on the website, it tells you a little bit more about who we are, and there's great resources on there. It takes you to other links, but there's a calendar. And on that calendar, you can choose when you want to talk to somebody. You can talk to somebody in the afternoon. You can talk to somebody after banking hours, is what we used to call them. You can talk to somebody on the weekend. If you call during the regular hours, the 8 a.m. to 8 p.m., you know what you're going to get besides exceptional service? Someone who actually cares to talk to you. We really do care about what we do. I mean, who went to high school? Honestly, raise your hand. Anybody out there watching says, I want to grow up and be an insurance agent for Medicare health plans. The most complicated insurance there is available because every it's always changing, right? No, it didn't happen. Most of us who are here working in this industry are here because we found ourselves helping our parent or helping people while we were doing other insurances, whether it be health insurance or life insurance. We saw that there was a need in the Medicare market, and we're like, you know what? That seems to be pulling on my heart. That's pulling on me a little bit. This is where I want to go. People who us People like us who are in this part of the industry in the Medicare side, we didn't get here by accident for sure. We didn't get here because there was an opportunity. We got here because we care. So whenever you call us, you're going to get somebody who cares. And we want to talk to you because there's a lot to know and there's a lot of decisions to make. And so, like I said, whenever through the experience we've had since 2006, we've figured out how to ask the right questions. But you know what you're going to get when you call? You're going to get a live operator. When you call during those banking hours I mentioned, you're going to get someone who answers the phone and gets you over to somebody. You're not going to have to be on hold and push buttons and select this, select that, or please hold while the options may have changed. Yep, you're getting a person. That's really what separates us because we're still in the human touch safely because we're working from home. But we are still going to give you exceptional service. We're just going to use today's technology, but you will get a person. But I do want you to go to the site because there's a calendar and you can click on that. Another thing you can do, and I do encourage this because you're seeing me here on YouTube. And I'm going to talk about a couple more changes in a scam. Okay, so hang with me. I'm going to tell you about some things I want you to ask for when you do call because we have some things to give to you. There's some important things. We call them bonuses or gifts. So hang with me. I'm going to tell you about those. But you're seeing me on this platform. But have you been to our Facebook page? It's Trusted Senior Specialists, LLC. Trusted Senior Specialists, LLC. So we have our Facebook page, but there's something deeper than that. On that Facebook page, you can go to a group, but we have to see if we're gonna let you in our circle. No kidding, but yeah, try to go into the group. It's called Your Medicare Matters because you matter. That's a huge thing to go into because in that group, there's other people just like you. Whether you're taking care of family and helping them or you're the Medicare beneficiary, we are there to help give information, but there's a community growing in there. And there's a lot of videos and gems. And plus, we have a lot of great things for your health. There's a lot of great things in there for food, just a great resource of what I like to call, it's my tag word, my personal tag word. I call it Medicare living. And I say that because living in a retired Medicare lifestyle is very different than living in the group health insurance working lifestyle. Very different. So I call it Medicare living for myself. Now, let me go back into some of these changes. Great things have happened. So we see that Medicare, which I just found out what the number was, 15 billion in savings over the last 4 years due to improper payments. I still cannot fathom this. I'm so glad that that audit happened. But what has Medicare done with all these savings? What are they doing? They are improving themselves and giving better help to the beneficiaries who deserve a better health system. And so here's how that's working. So technology is a big thing, right? We're totally into a more technical world. I mean, come on, we see funny pictures of babies being born and holding a cell phone, right? Or and you do hear stories. And yes, this does happen. A lot of people have a password on their phone, and yes, you hand it to a 2-year-old, they can unlock it. I don't know why. People are wired differently. So we're definitely in an age of technology, but Medicare has totally embraced that. So if you are a Medicare beneficiary, you now will be able, if a company has opted in to Medicare's innovative technology program, then you will be able to have access to that newer technology in regard to therapeutic treatment, surgical procedures, immuno deficiency treatments, whatever it is. If there's technology and there's data showing it works, the case studies, they will allow you to have access to that same treatment, that same therapy, that same surgical procedure, whatever the case is. They're going to give you access to that. You don't have to wait the 10-year study. You don't have to do that anymore. And I always think about, with the pacemakers, back in the day, pacemakers, whoa, whoa, Thanksgiving Day, can't go in the kitchen, turn it on the microwave. If you have a pacemaker, stay away. Do you remember that? People with pacemakers couldn't really go anywhere when these electronic devices were booming, or detectors and microwaves. You couldn't go anywhere with a pacemaker. Nowadays, forget about it. In fact, you can get a stent and a 2-hour outpatient procedure, which Medicare will pay, and go home, right? So we've changed, but the procedure, the surgical procedure, the therapeutic procedure, whatever the case is, if they have opted in with Medicare, you have access to that higher technology. You don't have to be on a group insurance to get it or beg, which is nice. Another change, real quick, with Medicare is ESRD, end stage renal disease. If you're under the age of 65 and you've been diagnosed with renal disease, end stage renal disease, ESRD, you at one time were limited to Medicare A and B only and a plan A. Now you have the option of moving into a Medicare Advantage plan, and that was passed because of the Cures Act. We saw the Cures Act come out, I think, in mid-June 2020, and with that came that change. So if you are a Medicare beneficiary, or if you will soon become a Medicare beneficiary because of ESRD, then you will have more options and opportunities of plan choice, because started January 1st, 2021, and that's really great news. Scam time. Okay, Medicare does pay 100% of the COVID vaccine, but where do you get it? So we know doctors' offices are getting the vaccine in stock now. Since last time I spoke to you, I did a little bit more research. Physicians' offices are calling people in. They're letting them know, hey, I have the vaccine. And I know a lot of the pharmacies are getting the vaccine. Besides CVS, some of the grocery store chains now have the vaccine, and we know health clinics. So more commonly out there more now than it was last couple times we spoke. Your Medicare will pay 100% for it. The good news is the scam is pretty much died out. What was the scam? You had it. If you want to get your vaccine now, we can put you on a list and you just pay a fee. That's a scam. So if that call ever was to come to you, just know that you don't have to pay your way to get into anything. The vaccine, let's say they say, hey, there's a shortage of vaccines. We'll reserve some for you for a fee. I kind of presume that's going to be the next scam, because that's going to be the next talk. So I want you just to remember that that will be a scam. Medicare will 100% pay for your vaccination. So let me real quickly tell you some of the things that we have to give you. I want you to call in the number 1-888-689-9701. That's the Sandra hotline. You're going to talk to a Medicare expert. We're going to ask you a few questions. We're going to get you narrowed down to what you need to do, when you need to do it, and what parts of the Medicare are important for you now, and then what parts of Medicare are important for you later, because it's really like an alphabet soup. Um, I want you to ask for, here's some of the giveaways. Make sure you get the New to Medicare guide. It's a digital guide that helps you understand the basics of Medicare. What is a Medicare supplement? What is a Medicare Advantage plan? What is prescription drugs? Do I need other coverage outside of Medicare? What about cancer plans? What about dental plans? How do those interact with my plan? What about COBRA? What about TRS, teacher retirement? What if I have TRICARE for life? Thank you for your service. What if I use the Veterans Affairs? Thank you for your service. What if I have retirement insurance? Hmm. There's a lot of questions there. And that guide will help guide you down to what you need to know. And then you're going to call us and we're going to go from there. The other giveaway is the 3Cs. The 3Cs is what goes over cost, co-payment, and coverage. You got to understand, how much coverage am I getting? How much coverage can I get? What do I qualify for coverage? And if I'm getting this much coverage, what is my co-payment, or what is going to be my co-insurance? You need to understand those things. So co-payments, costs, and coverage is an important guide that we have for you. That's another giveaway. Call it the 3Cs. And then remember to join the group on go to our Facebook page, but then join the group, because that's a little bit deeper of a community. Also, you can get the changes to Medicare. And again, all these will be digital. They'll all be sent to you digitally, but it's a great way for you to read and share. And anytime you want to look back and study again, you can. So I appreciate you guys joining me on this happy St. Patty's Day. Hope you all have your green on. If not, pinch yourself. so that you don't forget next year. And I hope that this information was very valuable to you. We love delivering information, especially one thing that we're really great at doing is helping you understand Medicare. We do it without obligation. We do want to earn you as one of our or customer family, I guess we'll call you customer family. We do everything without any obligation. We never charge for our services, but we make sure that what we do is non-biased and it's factual. So thank you, thank me. Thank you all for joining me today, and I will see you on the next event, or I'll see you on one of our other platforms. Have a great March 17th, 2021. Thank you guys.